Hi everyone, I am Dr. Shahan Layek, and today in this video I will teach you about inverted papilloma. Now, why I have chosen inverted papilloma as a topic to teach? Because inverted papilloma is one of the important topic that has been asked repeatedly in FMGE examination, NEETPG examination and INICET examination. So I have chosen inverted papilloma. Do you know what is the other name of inverted papilloma? Yes, Ringertz tumor. Whatever point I am saying, note it down or jot it down. It is very important and it has been asked repeatedly again and again. Inverted papilloma is also known as what? It is a question. Inverted papilloma is also known as Ringertz tumor. It is known as Ringertz tumor. The spelling is Ringertz. Ringertz, Ringertz tumor. The name is very important. Ringertz tumor is also known as inverted papilloma. Inverted papilloma. I will tell you why it is called inverted. Do you know why it is called inverted? Because this papilloma grows inward. It grows inward. Where it starts? This papilloma originates from where? This papilloma originates from the lateral wall of nose. Lateral wall. Remember, this is a MCQ. From where does inverted papilloma started or arise? Inverted papilloma arise or originate from? It originate from lateral wall of nose. You can see the picture from the lateral side of the nose. We get inverted papilloma. So inverted papilloma also it is known as Ringertz tumor, Ringertz tumor originate from where? Lateral wall of nose. And also remember that how do we diagnose inverted papilloma? What is the diagnosis? Diagnosis is based on tissue biopsy. We do punch biopsy, we do tissue biopsy, So there will be question, how can we diagnose inverted papilloma? We can diagnose inverted papilloma. We have to take the tissue, we have to take the biopsy of this tissue. So remember, the diagnosis is tissue biopsy. Whatever I am saying, this has been asked in the exam. Very important. Inverted papilloma, also known as MCQ. Inverted papilloma, also known as Ringertz tumor. It is known as Ringertz tumor. Where its origin? Again another MCQ. It origins from the lateral wall of nose. Very important. Next, another MCQ. Diagnosis. How can we diagnose inverted papilloma? We diagnose by biopsy, by tissue biopsy, or biopsy will be in the option. So by biopsy we can diagnose. So let me tell you something more about inverted papilloma. Inverted papilloma, basically it is unilateral. It can be found in one side of the nose. Unilateral. Another very important, leaf-like. It is leaf-like, just like a leaf. So it is leaf-like, unilateral, fleshy mass. So it is fleshy mass, just like a fleece. It is just like a fleshy mass. So these are important terminology by which we can describe the inverted papilloma. How inverted papilloma is? Inverted papilloma is a leafy mass. It is a leafy mass. How it is a mass? Fleshy mass, leafy mass, fleshy mass, or leaf-like fleshy mass, and unilateral. One side of the nose you can find. Unilateral. Inverted papilloma, one side. Unilateral. Remember, it is not bilateral. Generally not bilateral, but remember it is present as unilateral. Arising from the middle meatus. From where? Middle meatus. It arises from the middle meatus. So you have to understand another very important point which I am telling. Now jot it down. Now this point is very important for the MCQ because it has been already asked. Inverted papilloma is a locally aggressive tumor. Locally aggressive tumor. What do you mean by locally? Locally means it is benign. It is benign. Aggressive means invasive. Invasive tumor. So locally aggressive tumor means locally means benign, and it is invasive. Benign, invasive. This was a question. So it is benign. It is not malignant. It is benign. It is not cancerous. It is benign and invasive. It invade to the local tissue. It invade to the local tissue. Very, very important. It do not spread here and there. It goes in the local tissue. So it is benign and local tissue invasive. Benign and local tissue invasive. Now look at this picture. Can you see the picture? Yeah, this is a picture of Ringertz tumor. This is a picture of Ringertz tumor, which is also known as inverted papilloma. Revise with me. It is also known as inverted papilloma. Why it is called inverted? Why it is called inverted? Because it grows inward. It grows inward. Is it unilateral or bilateral? Is it unilateral or bilateral? Unilateral. Is it unilateral or bilateral? Unilateral. One side you can find. Unilateral. It is a fleshy mass. Remember, it is a fleshy leaf-like mass. Fleshy leafy mass. You can see. From where does it origin? It originates from the lateral wall of the nose. Remember, it is question. Lateral wall of the nose. How can we diagnose it? We can diagnose with the help of biopsy. With the help of biopsy. Now look at this picture. This picture, once again, let us revise and then we will stop. So first, always remember, it is a locally aggressive tumor. What do you mean by locally? Locally means benign tumor. It is not malignant. It is benign. It is benign tumor. It is benign tumor. And locally aggressive means it is locally it invade. So there was an option, benign invasive tumor. Benign invasive. So that was the answer. Locally invasive or benign invasive tumor, locally aggressive. Okay, it is not like a kind of cancerous. It is not malignant. Okay, remember, it is benign. Very important, it's benign. Second, what is the other name of inverted papilloma? What is the other name of inverted papilloma? The other name is Ringertz tumor. It is also a question. Inverted papilloma is also known as Ringertz tumor. Ringertz. Ringertz tumor. Ringertz tumor. Okay, Schneiderian papilloma. There is another name also. So you can remember this name also. Schneiderian papilloma. Schneiderian papilloma. Schneiderian papilloma. Same thing. Schneiderian papilloma. It is common in males. Basically 50 to 70 years. 50 to 70 years males. You can find out this inverted papilloma. 50 to 70 years male patient. 50 to 70 years male patient you can find. Where does it origin? I already told you. The origin you must remember. Origin is lateral wall of nose. Origin is lateral wall of nose. And it presents unilaterally. It is present unilateral, bilateral, unilateral. I told you. Lateral wall of nose, unilateral. And how can we diagnose? Diagnose by punch biopsy. Diagnose by punch biopsy. Very, very important is a punch biopsy. You must remember, it presents as unilateral pale mass. I told you, fleshy mass, leaf-like. And how can we diagnose? We diagnose by biopsy, by punch biopsy. Remember this. So inverted papilloma is very, very important. It is important for your exam. If you are sitting for NEETPG FMGE exam and INICET exam, please study this topic. This topic is very, very important. And if you are new to my channel, please subscribe this channel. This channel contains so many medical videos. All are diseases. All are diseases. Free of cost you can get. Only you need to press the subscribe button. Please subscribe this channel and help me to progress. Thank you. Have a nice day. Bye bye.